Our next speaker is somebody who I think you'll be very interested in hearing what she has to talk about, and that's the Fox Valley Memory Project. Lynn Ann Clausing Rusch, she's the program coordinator for that program, and if you haven't been aware of it or don't know the details, please do look into it after you hear from her. I think you will find it is a best practice for providing care and services for individuals and families that are dealing with dementia. Their organization was very helpful to the task force that the legislature used last session, and they really provided what I could say, again, is just top-notch, best practice. They are a model for what all communities should be doing. So with that, Lynn Ann, would you please join us?
Good morning, everybody. I want to thank everybody here for making the providing me the opportunity to be here and represent on behalf of the Fox Valley Memory Project. Listening to Maren talk about her past experience and what she did in her past life, in her career, made me think a little bit. I'm coming to the Fox Valley Memory Project. I've been with the Memory Project for less than 2 years. So what did I do before? I spent 37 years as an administrator with the Federal Department of Agriculture. Those rooms where my offices were full of books of procedure. We followed procedure. We didn't innovate. We didn't create. And this has been such a change and a pleasure for me to be able to, be creative and to collaborate and come up with ideas and make changes and tweak things, which that did not happen as in my prior career. So before I start with our program, I want to ask people to think about why it is so important to live well with dementia. For a moment, imagine losing your ability to do the things you love. You can no longer travel to new or favorite places. You can no longer be left alone with your grandchildren for concerns of safety. You no longer can have the ability to play cards, volunteer at places you always have volunteered at, to garden, or do any of the other things you have done in your life. How does that make you feel? Those are the losses and the concerns that persons with dementia face on a daily basis. So our goal with the Fox Valley Memory Project is to help people live well with dementia. That includes providing compassion, understanding, education, support, accepting people, including them, providing meaning and purpose, and finding joys in the moment for everybody. Some of our components are our memory cafes. Our memory cafes are an opportunity for persons with dementia and their care partners to be in that community, to make connections, to feel accepted and find joy and connect with others in similar circumstances. At the present time, we host 10 memory cafes at 9 locations in the Fox Valley area. We have attendance between 8 and 40 participants, depending on the location and the programming. Each cafe has a unique flavor, with many participants visiting multiple cafes each month. These cafes are supported by professional volunteers from all areas of the older adult community, as well as many volunteers that support memory cafes. The link that will be in your material will give you a schedule of our most recent memory cafes and the programming we offer. Another one of my roles with the Memory Project is to staff the Memory Loss Resource Center. In the Memory Loss Resource Center, we provide support, resources to persons with dementia, their family, their friends, their care partners, and other professionals working with persons with dementia through in-person meetings, support groups, phone calls, and emails. We have averaged 45 persons or families that we provide support to each month. We did an assessment of what I've done in the last 2 months, and these requests are continuing to escalate, and we're currently responding to 57 duplicated requests per month. These are persons that are reaching out for help because they have or are caring for somebody with dementia. These requests come from local health providers, they come from faith communities, home health care agencies, assisted and long-term living facilities. Another one of our focuses is our Purple Angel Business Education Program. To date, we have trained, it's now 140 businesses, on how to be dementia-friendly. We educate these businesses on how to recognize dementia and best ways to communicate with persons with dementia. They're also a source of financial support for us, because many times these businesses get on board and will support the Fox Valley Memory Project with our programming. They're also supportive of cafe programming and many referrals to the Memory Loss Resource Center and to our REACH program, which I'll talk about a little bit. People want to do things they have always done before they had dementia. They want to shop. They want to go to the bank. They want to recreate, go out to dinner in their community. This Purple Angel business training gives businesses the tools to support and educate their staff, as well as serve their customers in the best way possible. We do partner with Mosaic Family Health, where two of our founding members are on staff, Dr. Vogel and Beth Belmore. And at that site, at Mosaic, we offer assessments to screen, evaluate, and diagnose the cause and type of dementia. Those findings are then discussed with persons with dementia and their care partners, and then, again, provided back to their primary care physicians. We are also involved with a program developed by the Rosalynn Carter Care Institute. This is an in-home program that supports the care partner by addressing issues such as emotional well-being, stress management, and troubling behavior. And in that program, a certified caregiver actually goes into the home to provide resources and support for care partners. So how did we learn what we learned to bring this to the Fox Valley? Two of our founders, John and Susan McFadden, learned about the existence of memory cafes from Facebook. Susan's interest in research were related to her role as a professor of psychology at the UW-Oshkosh. Her connection in 2010 was an online forum where persons from all over the world shared their dementia experiences. Susan reached out to strangers in England to learn more about the programs in the UK, including memory cafes and Purple Angel programs. They then were invited to visit the UK in the summer of 2011. So what did they learn there? They learned about memory cafes with roots in the Netherlands. That concept began in '97 as a way to break through the stigma of dementia. There are many resources online, and most existing programs are very enthusiastic about sharing what they have learned, and we try to extend that same to people that are trying to learn to develop programs in their community. They also learned about the Purple Angel, or Dementia Education Awareness Program. There was a gentleman in the UK whose name is Norman McNamara who had dementia, and he was a driving force behind the creation of a dementia-friendly community. The businesses that he worked with, that he always went to, didn't understand him. He didn't understand his dementia. They could not communicate with him. So together with a lady named Jane Moore, they produced the design of a Purple Angel Dementia Awareness Program. When you're out in the community, we have wonderful partners that are educated, and you will see a symbol that is a purple angel. And I'm wearing one. I should have thrown a slide together with one. But the businesses with the purple angels in their windows have been educated on best ways to serve their customers. So how do we learn? You know, how do we tweak? How do we change? Primarily, one of the things that I really learn how to change my job and to serve my customers and my participants better is to listen to their needs. We had a call for more socialization. People wanted to be together. They have finally made friends again because they've lost their friends. They didn't understand their dementia. So we've had an extension of memory cafes. We now take bus trips, specialized bus trips designed for persons with dementia. We do theater outings right here. The university theater program invites us to their dress rehearsals so people can go to the theater without the stigma of somebody sitting behind them or next to them being annoyed or irritated that they're singing when it's inappropriately. We can attend dress rehearsals. We partnered with Xavier for their Christmas Stars and their Passion Play. So wonderful collaborations. Once a month, we hang out at Pizza Ranch for about 2 hours. People just come. We don't have a program. They just come to socialize and talk. It's just amazing. We do internal assessments, staff reflections. Often I'll look at myself and I'll go, well, that didn't work. What do we need to do differently? How do we tweak that? How do we change? And we have wonderful resources that I can talk to and say, all right, what's a better way of doing this? We do participant surveys, and I didn't put them on a slide, but we measure increased community integration and improved sense of well-being. And we've been very successful by doing annual surveys with our participants to see that we are seeing success in these outcomes. We do community surveys. There's a community survey that was done by Aging Together to measure our community education, how we gain and apply dementia-related knowledge, and how we educate our people in our community on what is dementia. We have outcomes and measurements, and we also measure our community attitudes towards dementia. So how do we learn? The collaborations have been incredible. It's just so enjoyable to have people to say, how can we help? What can we do for you? There are many persons in this room that we have collaborated with, and I thank you for that. We collaborate with law enforcement agencies, other county and city agencies, nurse department, nurses, ADRC, professionals, all professionals providing services to older adults. We're learning and teaching together. We're building relationships with those people, sharing our resources. What can we do to help you? And then continuing education for staff and our volunteers. We share our best practices. I get calls quite often from other states, other communities in Wisconsin, saying, how do you do what you do? How do you get people coordinated and organized? How do you start a program such as Fox Valley Memory Project? I was in Atlanta for a conference called Reinventing Life with Dementia, sponsored by the Dementia Action Alliance Group. And there I presented on our practices with Fox Valley Memory Project. What I learned there is that we in the Fox Valley are far ahead of the curve. People didn't know what memory cafes were. It was just truly amazing. But what we do here is pretty incredible, which I was not aware of. We adapt to needs when we teach groups. I will present to a congregation who's struggling with members with dementia, and how do we help them, and how do we keep them in our faith community. What I work with a congregation is going to be very different than what I work with when I work with a business, teaching them about how to communicate with their retail customers. So we need to adapt to who we're working with. And sharing who we are, educating businesses through that Purple Angel program, education events, community education events, any outreach, church communities, health fairs, and intergenerational activity. We do a few of these that are just incredible. We collaborated with Fox Valley Christian Academy last year and the year before with our choir. We have a Fox Valley Memory Project choir made up of persons with dementia and their care partners, and we visited the preschool. And the kids sang us their wonderful holiday songs, and then we sang them our songs, and then we sang together. So, it was a wonderful education opportunity for these children, and it was a wonderful joy opportunity for our participants who got to see these wonderful, beautiful children. So those are another way that we educate our community, even young people. Each one of those parents of those 4-year-olds went home with some additional information about who we are and who we serve. We also maintain a very strong social presence in our community. We have a Facebook page. I don't know who said it before, but Fox Valley Memory Project, I'm working on 500 likes this year. So like our page, please. We have an active website that's visited on a quite often basis, and then we also host a newsletter that we send out to participants and to care professionals in the community that goes to almost 550 people at this point. So in general, I'm just finding that when I'm speaking with other groups, we're far ahead of that curve. How do we continue to share our expertise? We need to continue to be involved in community conversations with dementia service providers, and that's everybody here. That's the Alzheimer's Association, that's Theta, it's everybody sitting in this room. We need to keep those conversations open and maintain a presence at all local and state summits to offer our input based on the experience that we've had in the Fox Valley. My contact information is up on the screen, and it will be in your materials. I am always more than welcoming for any of your questions and your concerns. If you're living or you're experiencing issues with memory issues, 1 out of 3 of us work very closely with somebody with dementia. And so we're here to support you. Thank you.
Thanks very much, Lynn Ann.